That 8 out of 10 people will have some form of back or neck pain in their lifetime. And a lot of times they're not sure what to do when they get that kind of pain. Well, this month is Physical Therapy Month, and here to tell us a little bit more about that is physical therapist Phil Oliveri from the Rockford Spine Center. Welcome. Welcome. Well, first and foremost, tell us, what do you do?
Physical therapists evaluate and treat movement disorders. We try to help people avoid further intervention, whether it be surgical or otherwise, and we try to help them have less pain, which is kind of PT. A lot of people want to say pain and torture. I say PT stands for party time. Some people think that's funny in therapy too, but in any case, we try as well as we can to decrease people's pain, improve movement, improve function, get people back to what they want to do.
Now, how can you tell the difference between something that might be like you slept differently and it's just a small thing, you know, compared to something that requires more therapy?
You listen to what the patient tells you when they come in. They'll describe the type of problem that they have. You can tell some people are a little bit more sensitive to what their body's telling them, and other people will tend to ignore what their body is telling them as far as pain or other symptoms. And, you know, just listening carefully, watching what they do, and then doing a thorough evaluation, you can tell, you know, what if the person's problem looks more serious than describing, or whether they may be inflating it a bit because they're just not used to that kind of pain or problem.
Gotcha. Now, there's been a real focus on workplace wellness. Right. Tell us about that.
Well, you spend a lot of time during your day at work and in the confines of your workplace, whether it's a desk or whatever it is that you do. Now, people that do very physical work obviously have more physical type problems. But, you know, people that spend a lot of time working at computers or in front of a monitor all day have their specific problems that they deal with as well, as far as posture and weaknesses and the type of things that develop because of the time that you spend, you know, performing the activities that you have to do over the course of a workday.
Okay. Now, you can show us what we're going to be able to do at home to help out, too. Let's walk over here
the counter.
And see what we can do.
The people that I work with on a daily basis will recognize these as my coffee stretches.
Okay,
and I tell people, when you wake up in the morning and you're brewing your coffee and you have your counter there in front of you, what you want to do. These are easier exercises. Or if you're at the gas station, if you're traveling, put your hands on the car, you can put your hands on the counter. What you're going to do is you're going to reach back and look back at your thumb,
like this.
Right, like that, and then back and forth, and right, left, nice and slow. Try not to use momentum. Try to do it nice and slow, careful and graceful like a ballerina.
Okay, I took ballet as a little girl.
It's obvious. You're very graceful here.
I think I remember.
Good. And you do 5 or 6 repetitions back and forth, and then after you're done with that, then you reach up and look up. Make sure you look at your thumb. You reach up nice and high.
Okay.
Good for you. Stretch your shoulders, stretch your neck, stretch everything you need to. Very good. And that's a real easy one. Anybody can do that over the course of a day, whether you're standing at the car or you're standing at your desk or you're waiting for the elevator or whatever it is you're doing.
All righty. And what else can we do?
Another one is I call it a pedal stretch. So you maybe, if I can step around you here, you're going to put your foot out on that surface, heel up or toe up with your heel, and what you're going to do, lean into it, keeping the knee straight, so you're stretching the hamstring.
I can really feel that.
Now what you're going to do is you're going to let the toe go forward without coming up, and then bring it back towards you. And then out again,
yeah, I can feel
that. And you're stretching the muscles in the legs and the calf, but you're also flossing that big sciatic nerve back and forth, and it needs to move a little bit during the course of your movements. So it's a good general stretch, and those are things you can do. You don't have to have any equipment. You don't have to set aside any time during the day. Just do them whenever you get the opportunity.
Well, thank you so much for joining us and showing us those great tips there. I plan to try some of those out.
You should.
Okay. And for more information, we can go to
the Spine Center. You can give us a call or check out rockfordspine.com.
Thank you so much for coming in.
Thanks, Evelyn.